It looks like the bullet side of a bullet.
Yeah, kind of.
Are there like actual names for the components of a bullet besides just bullet?
Just like the shell?
Yeah.
Like
well,
the
there's there's the casing,
yeah.
But then there's the bullet head. It looks like a bullet head.
Yeah,
okay.
It does.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Jordan Strong.
And for the last week of July, we are actually going to be doing something that we don't typically do on this podcast. We are going to talk about a product, which will mean that I probably won't say anything besides questions, and I will leave the disbursement, that's not a real word, disbursement of the actual subject matter to Dr. Jordan. Now, you might be asking yourself at home, Kevin, what product would elicit you guys spending a whole whopping 10 minutes discussing? And that's a great question, and that's a question you should have asked. The product itself is called the Phonak Lyric. And I have seen it a few times in practices. Jordan, I know your practice deals with the product.
We do.
So why don't you start by telling us what makes the Phonak Lyric so novel? Because it is unlike anything I have ever seen, and it's probably unlike anything most people equate to a hearing instrument.
Like a traditional hearing aid.
Totally.
Yeah, for sure. Yeah, it's the only device of its type that's out there. So what it is, it's made by a company called Phonak, which is like maybe the largest hearing aid manufacturer that's out there.
Good to know. I'm glad that we can support the little guy.
Yeah, there you go. And they probably have just the widest variety of devices that's on the market as far as different styles of hearing aids.
Got it.
So this one is very unique. I wish I would have brought one with me, honestly, but it's very tiny.
It looks like the bullet side of a bullet.
Yeah, kind of.
Are there like actual names for the components of a bullet besides just bullet?
Just like the shell?
Yeah.
Like
well,
there's
there's the casing, but then there's the bullet head. It looks like a bullet head.
Yeah, it does. Almost like the foam inserts that you put in your ear with like a flange on it.
Yeah.
Kind of looks like that.
Got it.
And they are yellow.
Yeah. Very vibrant yellow.
They are. So it's very specific. It's sized to each individual person. So it comes in multiple sizes.
Okay.
But it fits down into the ear. So there's nothing over the ear. It's only this very, very small little bitty device that's down in the ear.
Would you call it invisible?
Yes.
Okay.
Absolutely.
Love it.
For sure. Yeah. So it's placed so deep into the ear that one, it makes it more comfortable and you really don't notice it, especially after a few hours. You may at the very beginning, but after that, you're not going to really feel that anymore. So it's super comfortable. It fits way down into the ear, and you really can't see it. So that's a huge pro for most people.
I was going to say, so many people have still think of hearing aids as so taboo.
Yeah.
Don't want to talk about it. Don't even want to know that they exist. So for people who are hyper concerned about others judging them, this thing literally, unless you are with a magnifying glass, standing next to somebody in good light, are not seeing it at all.
For sure. Yeah.
And so something that's this inconspicuous, I was going to say inconspicuous, I'm sure some people listening would be like, well, like how good can it be if it's that small? I can't see it. Doesn't sound like it's battery powered. It doesn't sound, why is this small device so effective?
Yeah. So it's one, I mean, it sounds, I think it sounds, and the patients tell me that it sounds more natural than what they would expect a hearing aid of its size to sound like.
Sure.
Because it's using the natural components of your ear. You know, our pinna, the outside of the ear is designed to funnel sound into the ear.
Yep.
So by having a device that's down in the ear and not using a microphone placement that's out of the norm, that it's, where we would naturally hear sound anyway, then it sounds more natural.
Obviously, everything in the world we're trying to make what was once big super small, right? But you lose things along the way when you make it so small.
Yeah.
And my dumb layman brain is like, but where does the battery go?
Yeah.
But it's not meant to be a lifelong insert.
Correct.
You're supposed to change it out all the time, right? And why is that? Is it because of the actual technology?
Because it does have an internal battery in it, but it's not a battery that you replace like a typical hearing aid. It's not a rechargeable hearing aid, none of that. It's got an internal battery that lasts on average about 3 to 4 months.
Okay.
Which means that the wearer has to come into the office about every 3 to 4 months to have that device removed and then a new one put back in.
Got it.
If not, and it's likely that at some point that the wearer will experience that the hearing aid will die sooner than what we may have calculated it to, give or take. And then they're kind of walking around with an earplug in the ear.
So I was going to ask what it's a guess. It's a rough guess about how long it will actually last. What would make a lyric die earlier?
Honestly,
too many concerts.
I mean, not really even that. It's just sometimes it's just the device itself.
Okay.
I mean, how long has it been sitting on the shelf? That type of thing.
Got it.
Also, earwax is a big factor.
Okay.
You know, that in general, if you are someone who produces excessive earwax, then this is probably not the device for you anyway.
Sure.
But still, even sometimes having a little bit of wax there will kind of clog up the microphone.
Got it.
And then it's got to be replaced.
And so if somebody is listening and they're like, I don't know, it feels like an implant, like, is there surgery involved? How painful is it? Am I going to feel uncomfortable?
Yeah.
Tamp down all of that worry, because I've seen it and it's not anything to be scared of.
Yeah, nothing like that. Not at all. It is not scary. So what would happen is, one, it's not an implant. There's no surgery, nothing of that sort. What would happen is you would go in to see your audiologist that day. And we would size the ear, which means that we put this little tool down in the ear. You don't even feel it. We're just measuring how deep is the ear canal. And then we're looking to see the circumference of the ear canal. How big is it, so that we can place the right size device into the ear, and how deep do we need to place it into the ear. We put a couple of, it's a sizer, which is essentially just a dummy version. So it's just the outside components of the device. And then we put that into the ear, make sure it looks good. How does it feel?
And are you looking for a full seal?
We are.
Okay.
Yeah. So we're looking for it. We don't want any gaps. We don't want it to be folding over on itself. We don't want there to be any type of gap to where sound can leak back out. You've got feedback and whistling. So we want to make sure it's a good fit. And then we take that one out. We actually put the real device in that is programmed to that specific person's hearing test that we've already obtained. And it's programmed at that point, essentially just like the other hearing aids.
Who is the right candidate for this? Who, if somebody's like, I'm at home, I don't want to be able to see my hearing aid, I don't want people to make fun of me, but I should probably understand my level of hearing loss that's right for a lyric. Who's the right patient for a lyric device? Yeah,
so one component to that is it's only going to fit people with a mild to like a moderately severe hearing loss.
Okay.
Anything more than that, it's really not going to work well for you. It's not going to reach that limit that we need it to get to. It's also really good for people who are like very active people. So like, I know I personally have some patients that are like coaches and things like that, who are just like, I don't have time to be thinking about a hearing aid, be putting it on, taking it off, charging it, batteries, all the things. They don't want to have to worry about that stuff. So it's really good for those types of like very active people. I've also found that it's very good for some of my patients with like severe cognitive decline.
Oh, okay.
So like I have some patients that come into the office who they've been wearing hearing aids forever, but now they're at a state where, they may be in a facility and they've lost their hearing aids, and the family's having to pay for replacements and loss and damage and all of those things. So this can be a really good option for them of, hey, their loved one's going to bring them in every 3 to 4 months. We're going to take that device out, put a new one in. They're good to go for another 3 to 4 months.
Is there anything of note where you're like, the only drawback of lyric is X? Is there one moment where you're like, of all of your lyric users, has there ever been a moment where you're like, this has only happened once, it is not par for the course, but it is something that we're aware of now? Not like it exploded or anything.
No,
like that.
I will say there are some people in some ears that just reject it.
Got it.
That's how we put every patient that comes in the door who say they want to try lyric. we make you do a trial period. Like you're not going to come in and actually just purchase it that day typically. Like you need a trial period. We need to make sure that your ears are not going to reject that device.
Got it.
So maybe a week, 2 weeks, up to a month sometimes,
Sure.
depending. But it does take some time to make sure that that is a good fit for that person before we go in, because these devices are actually on a yearly subscription. So
Okay.
it's not like a one-time buy thing. You pay for this on a yearly subscription. That way you can come in however much that you need to
Got
have
it.
that device replaced.
Which I imagine is a wonderful luxury for people
Correct.
if they're going through it faster than that 90 to 120 days.
Right. Yeah. The other thing to keep in mind with this one is there is no Bluetooth capability.
Okay.
In our current world
Sure.
with hearing aids, that is such a norm,
Yeah.
honestly, that it's become just a norm and a standard to have Bluetooth within your traditional hearing aids. It's a great feature. I wish we could fit it into a lyric,
Sure.
but it's just too small to fit that type of technology. So that's one thing to keep in mind. Now, however, you can still wear like headphones, Bluetooth headphones, that type of thing over your ears like you normally would without anything. So that's kind of unique.
Sure.
But just keep that in mind if you're interested in lyric, that's not something you're really going to have.
Makes sense to me. So for more information about Lyric or any other hearing devices, feel free to go on over to askanaudiologist.com. And of course, if you think it's right for you, make sure that you talk to your own hearing care professional to make sure that they jive with that same belief. Dr. Jordan, bang up job.
Thank you.
We'll see you guys next week.
See ya.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.